Good afternoon. As Dr. Sofer said, I'm the CTO of AppWorks. AppWorks is a Miami-based technology company. We provide optimized healthcare delivery solutions through the use of mobile technology. We have a few different healthcare platforms, healthcare platforms. Our primary focus being clinical photography solutions for physicians. We began in the venous industry. We've got a couple hundred doctors in the venous industry currently using our software. We've since branched out into healthcare, into wound care, plastic surgery, aesthetics, and prosthetics. So, uses of clinical photography. Clinical photography has become a lot more commonplace over the last few years for a number of reasons. One of the primary reasons being insurance claims. Especially in venous, I found that insurance companies are more and more commonly requesting photos be included with insurance claims for venous issues. So doctors, even doctors who have been apprehensive about implementing clinical photography into their practice are now having to do so because of the requirements from insurance companies. Expectation management is another huge factor for clinical photography, especially in venous or anything exterior orientated. I can't tell you how many times I've seen a patient come to a physician and say, okay, I don't think we're making any progress on my veins. My veins aren't getting any better. And the patient has to be reminded of what their veins look like. Now, to try to describe to a patient, well, geez, don't you remember you had terrible varicose veins, just doesn't cut it. But if you can show them a photo of what their veins look like, that's going to help you with the expectations. Also, I've seen quite a bit in spider veins as well. Patients coming back and saying, geez, you didn't cure these spider veins on my nose. Without a photograph, you may not be able to respond to that effectively. With a photograph of those spider veins, you can often show them that, yes, in fact, we did treat these spider veins that were in your nose. The ones that you're showing me now are new spider veins. Treatment documentation, huge factor for a number of different reasons, be it lawsuits, be it insurance. Document that treatment that was done. Treatment evaluation is huge as well. Many of my physicians, when I follow them on procedures, as soon as they walk into the room, they already have the patient's previous photos pulled up on a screen in the room. The reason being, it's hard to know where you're going if you can't tell where you've been. So being able to look at the effectiveness of previous treatment is very helpful in determining the course of your next treatment. Sales and marketing is something I'm going to touch on quite a bit today because I think that is probably the most misunderstood and underused component of clinical photography. Sales and marketing, there's a number of different ways to effectively use clinical photography in sales and marketing. Now, I would bet 99% of the time, if you're doing venous treatment and a patient goes to your website, once they get past that first page where they've read a little bit about you as a doctor, the first place they go is the before and afters. They skip right over the treatment options, the bios, and they go to the before and after photos. So if you're not able to effectively show visitors to your website and visitors to your office the services that they can expect and what they can expect from you, you're going to be at a disadvantage. This is a report actually that generates from one of our clinical photography tools. There's a number of different types of reports. These type of reports can also be used for a variety of ways of sales and marketing. Many of my physicians utilize these type of reports for initial consultation. So a patient may come into the office for an initial treatment. They walk out with a report like this. In the upper left-hand side is your company's logo, pertinent patient information, but most so is the pictures. Pictures really make people think, especially venous or exterior patients who may not have a full grasp of how bad their venous disease is, and they've walked out of your office with pictures of venous disease or some other kind of aesthetic issue that they're looking at, and there's this piece of branded marketing material. A lot of my physicians also use these type of reports as part of the course of treatment. On a third or fourth visit, they may give the patient something that details the treatment process and shows that patient, hey, look, these veins are getting better. You are making progress on this, and that'll keep it coming back. Another use is providing your referring physicians with reports. A patient may come in for their first visit. They were referred to you by another physician. after you've completed a course of treatment, you might send one of these types of reports over to the referring physician to say, hey, look what I did for your patient. So, now there's a few different solutions for clinical photography. Before we made our mobile solutions, there was Canfield. There's a typical Canfield setup right there, costed probably about $15,000. And then you had your standard cameras. And when I decided to start building this clinical photography platform, I watched how most doctors were doing clinical photography, and it was with a standard camera. And the process of cataloging the photos was painstaking because they would take the photos, they would have to, at the end of the day, pull the memory card out of the camera, put it into the computer, upload those photos to the computer, catalog them. A lot of times they would forget which side of the body they were looking at, so it was really not a good process, not an efficient process for cataloging photos. So we made our platform, which streamlines the process of taking these photos and managing them. Photos are, you select the patient, select the body area, select the specific anatomy area, take your photo, and then those photos are then sent to the cloud, to a HIPAA-compliant cloud server, where you can actually manage those photos from a PC from anywhere. So it really streamlines the process of taking these photos and cataloging these photos. One of the things that has come about from developing this technology is that I found that we not only had to develop a streamlined clinical photography tool for doctors to help them collect these photos and organize them, we also had to do a lot of work with doctors in training them how to do photography. Now, I've always had a passion for photography, and I realized that clinical photography is something that just doesn't get taught to a lot of these physicians, so we found ourselves having to come in and train physicians on things like lighting, positioning, shadow, distance, and backdrop. Because a lot of times we were getting calls from physicians who said, hey, your software takes really bad photos. And we would say, well, the software actually doesn't take the photos, you're taking the photos, so let's have a look at these photos and see where the issues are. The issues are usually pretty common that we find. A lot of times these are the type of issues that we get when we get in there and the doctor's telling us that our software doesn't take good photos. Is we look and, you know, on the left-hand side you have an example of a poorly taken photo. You can see that the photo is taken from a great distance back. It's taken at a downward angle. The lighting is improper. There's bad shadowing. And there's no backdrop, and backdrop is actually one of the most, I can't stress enough the importance of having a proper backdrop to give you that difference in tone from the skin color. Here they're taking a picture of legs on a beige wall, so you're not going to get that type of difference. And also lighting, if you look on the right hand side, you will see the importance of proper lighting where those spider veins are well illuminated. And that is my talk on clinical photography.